Hey guys, hope everybody's doing great today. This is Coach Bill with Weight Loss Made Easy. Let me move my stuff around here, get myself centered here a little better. There we go. Sorry I wasn't ready to go when this thing turned on. So guys, excuse me, what is today? Oh, I should know. Thursday, because this is my 24-hour fasting day, or Emily and I's 24-hour fasting day. As you saw when we first got on, this is a cup of coffee, black coffee. I have 0 calories in it, so it's just black. On Tuesdays and Thursdays, we do a true fast, which means we don't have any calories at all day long. Okay? So guys, this is, like I said, Thursday, great day. Actually, every day is a great day. And today, guys, I've been pushing off this topic for the last 2 weeks because I've been putting other topics in front of it. But now this is getting ridiculous. And I had a conversation with one of my clients. Now, you guys, this information that I'm about to give you the article will actually be in my YouTube description section. Those of you that follow me know that I like science, and whatever I talk about, I like to follow up with science. So what I'm doing now from now on is I'm doing these little short entry videos, but I'm doing a blog post that is very specific with all the science and gives you more information. So what you're going to have to do to get more information is go to my YouTube channel, type in Bill Mabry, subscribe to it, find this video after I'm done with it, and I download it in YouTube, and then hit the description section. Then all the blog post will pop up with everything that I talked about and more, and the science. And also you can go to my Weight Loss Made Easy Solution Facebook group private page, and the video will be downloaded in there also, so you can go in there also and get it. So I'm trying to keep my videos down to a maximum of 15 minutes. I seem to go rampant sometimes, and I got to stop from doing that because I like to talk. So guys, today this topic is getting ridiculous now. In the last week or two, I've had a couple conversations with my type 2 diabetic clients. You guys know that Emily and I have become specializing in type 2 diabetes, pre-diabetes, and fatty liver, which we're helping people reverse those. The byproduct of all that is, of course, losing body fat. I'm not talking about bathroom scale weight. I'm talking about real body fat. And so the subject is doctors still don't get it when it comes to reversing prediabetes, type 2 diabetes, a fatty liver, and obesity. They still don't get it, even though their own scientific sites are showing them proof that you can reverse those underlying diseases naturally with foods and, of course, hydrogen-rich water, which also has scientific proof showing it actually helps to reverse these underlying diseases. Now, I just posted on my Facebook group page that there's actually a 220 new scientific case study showing specifically hydrogen-rich water is one of the fastest and simplest way to lower blood sugar. And that just came out a few months ago, so I posted that. But what's getting irritated to me, and I guess you can call this a rant, is that we're showing certain doctors proof. My clients, I have all my clients doing a live blood glucose test, and they also do a live blood ketone test to see their progress when they've changed their lifestyle and have gone on our diabetic program. And even though some of the clients have glucose meters that are actually tapped into the doctor's office, and they're showing consistently that their blood sugar is dropping and dropping and dropping. They're still having a hard time comprehending what is going on because of their education. The problem is they're educated in medication. Now, what I did in my blog post, guys, I put an example of a brand new client that I just picked up, and he's been a type 2 diabetic for a while now. And we did our first glucose level before we got started, which I have all my clients do. And his glucose level was 200 and what? Let's see. 220. Dangerously high, guys. Dangerously high. Those of you that follow me, I've talked about this, the side effects of having diabetes, especially long term. And on top of that, he's taken medication, which I think he said he was taking medication for 9 years. So get this. Here's the doctor is giving him medication. He's going in periodically to see the doctor. The doctor knows he's on medication, and yet his blood sugar is still high. Now, how does that make sense? Obviously, and we know this, and you guys that follow me know I talk about this all the time. We know medication will never reverse diabetes, type 2 diabetes, prediabetes, or a fatty liver. It never will, ever. I've got proof here showing that it doesn't. But yet the doctors don't see this. Or if they do see it, they don't care as long as they keep filling their wallets up. Okay? And besides that, there's plenty of research showing that by changing the types of foods you're eating, combining it with intermittent and prolonged fasting, and combining it with changing the type of water you're drinking, you will naturally reverse those underlying diseases and get off all medication. Emily and I have been involved in the health industry for over 40 years. We have got a lot of experience under our belts. We have helped hundreds and hundreds and hundreds of people. We have actual blood test readings that I've documented, proof showing the improvement. But yet, when we show the doctors these, they just don't get it. Some of them do. I have a couple clients that have great doctors that are telling them, you keep doing whatever you're doing because your A1C has not been down this low in 14 years. You are now down in a healthy level. Your A1C is normal. We get this all the time. Our program works when the client is consistent and follows directions. I'm not a doctor. I don't want to be a doctor. I don't want that name. But we've educated ourselves, and our program that we use is science-backed, and there are more and more doctors that are now seeing our proof by these blood tests that you can reverse these underlying diseases naturally. So in the blog post, I had put some documented pictures of a couple of my clients who I'm working with right now, especially the one I was just telling you guys about, how this client for the last 6 to 8 weeks, his blood glucose readings and he's taken it about every couple of twice a week, is consistently down in the mid 80s and 70s, but yet the doctor's isn't taking him off the medication. Yes, you've got to slowly go off of it, but he's got to get him off of that. Because see, the problem is now when we're doing a 24-hour fast, which puts you into a very, very healthy environment, especially if you're a type 2 diabetic, that the medication he's on is causing the blood sugar to drop lower than I like, so I can't put him back on the 24-hour or 32-hour fasting, which he needs to be in if he was not taking the medication. You see what I'm saying? And the doctor is not getting him off this medication, which just does not make sense. So obviously, the conversation I had with him, I posted that in my blog post so you can read the conversation between what his doctor said and what we are saying. I want you to see the ignorance that's involved here and that there's in the documentation that we have. Now, Emily and I have a program that we've developed. It took me a while. It took a lot of research to develop it. It took clients that I'm working with to see, we've learned a lot with each one of you or each one of our clients because we're all not the same. So certain foods may work for you and not that person, or your blood sugar may drop faster than somebody else, and there's a reason for it. So what I did was I put in there, I Googled, so you guys can see this, I Googled what is insulin resistance. See, that's if you have prediabetes or type 2 diabetes or a fatty liver or you're obese or overweight by 20 pounds, basically it's your insulin resistance. That's where it starts. And I Googled it. And so this is what Google said. It says, because you are eating so many carbs per meal and during your multiple meals per day, you have overflowed your cells with sugar, causing insulin not to open up the cell to let glucose in. The leftover glucose is then dumped into your blood, causing a high reading of sugar in the blood. This will cause the root cause of all diseases, not just type 2 or pre or fatty liver, all diseases, inflammation. This has caused inflammation. That is a little short explanation of what insulin resistance is. See, your cells are so dang jacked up and full of glucose. The excess glucose you're eating from the carbs you're eating and the processed carbohydrates and the processed sugars you're eating is being dumped right back into the blood. And over time, if this keeps happening, you're going to gain fat and you're going to become a type 2 diabetic. So that explanation is in my blog post that you guys can read. I also put in there our diabetic program that we offer to our clients goes like this. So I explained a little bit about how the program works. So you guys, if you know somebody or have a family member that's a type 2 diabetic and you're concerned, pass this on to them. Show them the video. Let them know that there are many doctors out there right now that have completely changed their health format, are getting away from medication because I already have proof here that it doesn't work, and they know it doesn't work, and they are now actually reversing type 2 diabetes naturally by changing the type of foods they're eating, changing the time they're eating their foods, and obviously the type of water they're drinking. Now, guys, most of you that try to do this on your own, I'm going to give you a little word of advice. It's probably not going to work because it's confusing sometimes. Our program, we educate people. By the time our 12-week program is over, you're fully educated where you can help somebody else. But the first 12 weeks is very, very important in order for you to be successful in your journey to either reverse these underlying diseases or lose body fat. You're not going to hear me talk about weight loss anymore because there's a definite difference between bathroom scale weight loss and then fat loss. Big difference there, and I explained it in one of my videos. So you can go back to my YouTube channel, find that video that explains the difference between a bathroom weight loss and fat loss. There's a big difference there. Okay, guys, so as I said in that blog post, obviously I have more information on our program and how we reverse these underlying diseases. You can go to my YouTube channel, type in Bill Mabry, subscribe to it, find this video, hit the description, and that blog post with the science will be there. Okay, you guys can go look at that. Also, if you were to go to YouTube, type in Dr. Jason Fung, Check him out. He also does seminars. We learned a lot from him, and he has all the science research on it. Those of you that have type 2 diabetes, you need to get on Amazon by Dr. Jason Fund's book called the Diabetic Code. All the research, all the science is in that book. So you don't even need to look it up on Google. You buy that book, he's got the science in there. Same science I have in my file here, but it's in his book. Okay, guys, so I recommend you guys who have those underlying diseases, and if you're obese or you need to lose 20 pounds, that's another way. I like my clients to actually buy that book after we get started. Okay, guys, so guys, like I said, go to my YouTube channel, check out the blog post in the description section of it, and learn more. Okay, so I hope you guys actually got some value out of this. And I'll see you guys in the next video. I've got some exciting news coming up about helping people who want a quick start losing that body fat. I got a program that we've been working on for about 2 years, and I've got enough information now to actually open it up. So I'm really excited about that. So be looking for that. Okay, guys? You guys have a great day. This is Coach Bill, and I'm signing off. Bye.